Donnie, do we know if Mr. Curley's on the line yet? Not yet, okay. Great, thank you.
We're good to go, right?
Yep.
All right, well, I'd like to welcome everybody to the October 24th, 2024 Allen County Public Library Board of Trustees meeting. And Madam Secretary, if you would start off with the roll call, it'd be greatly appreciated.
Two. Roll call, Mr. Eisbart. Ms. Shamanoff, here. Mr. Pastrick.
Here.
Mr. Seifert. Mr. Williams.
Present.
Mr. Moss.
Here.
And Mr. Curley. So I believe we do have quorum.
I would entertain a motion to adopt the agenda.
So moved.
Second.
And all those in favor, please say aye.
Aye.
Those opposed, same sign. Carries. We have 3 minutes from the regular session of September 26th, the executive session of September 26th, and then we have approval of claims for October 9th. And I believe we can take all of those in one motion if somebody would like to provide that.
So moved.
Second.
Thank you. All those in favor, please say aye.
Aye.
Right, moving right along. We have financial report under number 4 for September 2024.
Yep, thank you. In your packet, of course, is the treasurer's reports. And first, a couple of lines. This time of year, it's traditional. We have a few lines that are starting to push the budget benchmark amounts. 3 of them I've noted in here. Telephone service. We had a little higher Ethernet costs. You know, we're having less E-rate funding on that. But traditionally, that ends up coming in low at the end of the year. So I'm not sure how much we'll need to move over in there, but I wanted to note it here. Professional services is spending high. That is directly related to the chiller solar roofing project going on. So that will actually be covered by bonding fund, or the additional appropriation will move money in there. And then the last thing is our traditional one, landscape and snow removal. I had Darton, our environmental service, talk with them, and we did it a long time ago, but January, February, March, we did have almost double the number of days that had to have snow and salt activity in there. And so that line is going to need a little bit of help at the end of the year. Again, depends on how bad December is. If it's a light December, we may not need a lot. So, but those 3 lines are ones that I've noted in this report. The other big items, of course, on the agenda is the finalization of the 2025 budget documents. That's Form 4. I'll talk about that as a separate motion, but that will be passed. And then once we approve that, I will have that loaded into the gateway system by, I've got 4 days, but I'll probably do it tomorrow. Just get that done. And then the only other thing, Lorraine has a large presentation that she'll be doing this afternoon. If you recall, we're moving our benefit approval, the package for benefit, to the October board meeting. November will still be the compensation side, but we'll want to get an early jump on that. Those are really the only things I have to report on right now. But I'm glad to entertain any questions.
Are there any questions for David? All right. Well, hearing none, certainly entertain a motion for approval of the financial report for September 2024.
So moved.
Second.
All right. So moved in a second. I think we're getting redundant here on these. All those in favor, please signify by saying aye.
Aye.
Those opposed, same sign. Motion carries. Approval of claims.
All right, the claims for today total 1.147 million. Really just miscellaneous items. The highest one is only 53,800, and that was for the system-wide electrical service. And then 37,000 was self-insurance items. So the rest is just books and general business items. So really not a whole lot to report on this one. It's the second one of the month. It's usually.
Any questions?
I just have a comment. So what I want to say is Chairman's joke that kind of redundant. You do a really nice job of putting this. The information's there. It's very clear. The things that we would ask, why is this high? Why are we having a problem? You've given us good information. I appreciate that at all levels, whether it's the monthly reports, what we're going into with the budget. You've got your ducks in a row. You make it easy for us. Thank you.
Well,
Dave.
thank you.
I know your days are numbered here. I want to make
Oh,
sure.
well, I appreciate that, Pat, and it's come through years of experience of having questions posed as like, well, I don't know what the answer is. I'll find out. So you learn to, okay, I better try and anticipate some of those. But believe me, I'm leaving it in good hands. Jill knows the same stuff as I do, so you'll be in good hands.
Great.
Safe to assume the transition is going well so far.
I try not to think about it. I know, there's still some people that are saying, well, yeah, we'll get to that when Dave leaves in 2026. It's like, no, it's not going to be 2026, trust me. So. But yeah, it's going well.
Good.
Now, ask my wife, it might be a different answer on that. You know?
All right. Okay, hearing no more questions or comments, would entertain a motion to approve the claims.
So move.
Second.
Thank you. All those in favor say aye.
Aye.
Those opposed, same sign. Sounds like Shirley may have just joined.
Yeah.
Welcome.
Good afternoon. Sorry I was late.
Okay, number 6, ordinance for appropriation and tax rates and approval of the budget.
Yep, that one, as I mentioned a few minutes ago, this is Form 4. This is the only form anymore that needs board signatures on that. And as you recall from the prior month where we had the hearing, we are looking at a $40 million, 039,959 budget, operating budget. Now, that's the official one. Our internal budget will be $37,940,000. That incorporates the tax cap losses that we incur. The levy will be $30,829,292, sorry. And right now, we've advertised a rate of 13.5 cents. However, we are anticipating that will actually be lower. We always want to advertise high so that you capture everything, of 1.176 cents. And that will, if you recall from my last presentation, will be a 4.62 decrease from our 2024 tax rate. So we're actually having a tax decrease to the taxpayers. So that was a good way to go on that. But like I said, those are the key items. I have, again, heard no comments. There's been no filing of comments by the public to adopt with this ordinance. So at this point, it's ready to go and for approval. And there should be a copy of Form 4 in your packet to refer to.
Are there any questions or comments for David? This is easy. All right, well, entertain a motion for approval of the ordinance for appropriation and tax rates and approval of the budget.
So moved.
Second.
Thank you. All those in favor,
Aye.
please say aye.
Aye.
Those opposed, same sign. Like it has passed.
All right, I will bring both of this and the claims around for your signature.
Okay, number 7, we have a presentation for the 2025 employee benefits package. Hello.
That I can't answer. So I have Alan and Shirley from Gibson. Thank you for being here. And Drake from Parkview. So I want to present our 2025 benefit package. We talked about this in the August FNP meeting and was hoping to split this from the salary so that we have a little bit more time to get open enrollment materials and communication out to staff. So we're bringing it to you today. I'll start out with our health plans. So we're maintaining the same traditional and high deductible health plans as well as the narrow network options. We do need to increase the high deductible health plan deductible from $3,200 to $3,300 in order to be in compliance with ACA. We didn't raise premiums last year for staff, but we will be slightly increasing them for 2025 to keep up with those market rates. We're looking at roughly 1% increase like we talked about in August. 1% can be as low as $3 to up to $15 per month. There's no plans or premiums that increase more than that $15. And you'll see those 2025 premiums in your packet. We plan on continuing the spousal carve-out like we've done in previous years. So if spouses are eligible for benefits through their employer, they can't be on ACPLs. We currently have 37 spouses enrolled in our medical plans. We had 40 last year, so we usually hover around that 35 to 40. We're also maintaining the tobacco premium, so a 40% premium increase for employees who are tobacco users. There's currently only 9, so 9 out of 250 is pretty good. The HSA contributions from ACPL, we want to keep the same for next year, although the employee voluntary contributions can increase to the new limits. So again, we give about $1,300 for individual HSA plans and $2,600 for the family plans. We're planning on staying with TrueRx as our pharmacy benefit manager. This was our first year switching to them. We've had a good member experience, a good service experience. They still partner with Sharks for those specialty or high-cost medications, and we plan on continuing that for next year. No change in MetLife. We actually can keep the same rates for 2025 and 2026. So we're going to keep dental, vision, voluntary benefits the same. We do have a $1 per year employee-only premium for dental and vision, and it's an administrative nightmare for our finance team. So we are looking at getting rid of the $1 per year. Staff who don't want to be on our dental or vision, just sign a waiver to say that they're declining that insurance, but that will save our finance team a lot of headache. We are also proposing adding a voluntary pet insurance through MetLife. So this is totally voluntary. There's no fee for ACPL. And staff would enroll directly through MetLife. And it depends on the breed of pet, and they will handle the enrollment directly through MetLife. This was mentioned a lot in our benefit survey, so we're hoping to offer it. Any questions so far about the plans that we've had in the past? Not much of a change.
Lorraine, I have a quick question. If it's appropriate to ask, what's the distribution among the 4 plans? About what percentage of each of these gets used by folks?
If I'm guessing really rough, I would say a little bit more than half on the traditional copay plan in the upper left corner, I believe. Yep. About 40% on the high deductible, and then a very low percentage split between the narrow networks. I think we had 13 staff on the narrow networks.
Thanks.
Okay, I'll continue on. So one thing that we talked about back in August, we are proposing to add, it's called an ICHRA. It's an individual coverage health reimbursement arrangement. We talked a lot about our part-time staff who work 20 to 29 hours a week, especially those that are at the 28-hour-a-week mark. Sometimes they make too much to get on the state benefits, and they don't make enough to be on our benefits. So this is not health insurance. They would still go through the marketplace for their health insurance coverage. But if they enrolled in our ICHRA plan, we would cover a portion of their premiums. It's a voluntary benefit, so if staff don't choose to participate, they forfeit the cost of that benefit. The plans on the marketplace, as most of you probably know, are age-banded premiums. So we have the stipend amount in your packet based on the hours that the employee works per week and their age. We are looking at working through a company called Gravy, which is really fun to say in a meeting like this. So Gravy would handle the administration and the enrollment through the marketplace. It's hard to calculate what this could be fiscally, because if one person does it, it's not going to be a big cost to us. If 20 people do it, it'll be a bit bigger. But based on a survey that we did and based on Gravy's financials, they estimate potentially, if everybody takes it, it could be up to $84,000 a year. I don't think everybody will take it, but it's good to have that offered, especially to staff that don't get benefits through ACPL and are really vital positions. So a lot of these are branch assistants that do a lot of the customer service and patron interactions that make us successful at our branches.
That's a nice benefit addition, in my opinion. Is it paid, is the stipend percentage of the premium, or how does that
So
work?
it's broken down by staff that are 25 to 29 hours a week, so really those 28-hour-a-week employees. They have a bit bigger stipend per month, but it's also based on their age. So the stipend goes higher the older they are because the marketplace plans are age banded.
Thank you.
And I hate to add benefits and take them away, but we don't know how many people would enroll in this. And so we'd like to propose it and see how it goes for a year or two to see if it's a benefit that our staff utilize and is not, is that we're capable to provide, so. Yeah,
And to be clear then, so the budget's based on everyone participating.
yes, yes. Yeah, and some staff already have plans through the marketplace, and they have subsidies. If they chose to go on our ICRA plan, they would forfeit the subsidy. So some staff may not want to do that depending on what subsidy amount they're getting. Any questions about ICRA? That's a new change, okay. I'm going to ask Drake to come up because our last change we talked about last year, but at this time, Parkview employer clinics only had one option in Allen County, which was a conflict for us. But Parkview's changing their group package tiers in 2025. So traditionally, we would pay for things sort of ad hoc. If we did a wellness event, we would pay for that. If we wanted to add in a diabetes prevention program, we would pay separately for that. Now they're putting them into packages and tiers. So we would propose to join the Parkview Platinum package, which should be in your green folder. This would allow us access into the employer clinics for staff that are on our medical plan. And I won't take away from your presentation, Drake, because it's probably better than mine, but I'll let you present for 3 to 5 minutes and ask questions, and then we'll talk about price.
Firstly, I just want to say thank you for hosting Parkview here today. I also want to thank Alan and Cheryl for being my support here today and just the partnership that we have together. I will try to make this brief. This is a pretty long slideshow, but I was told I have about 3 to 5 minutes to present. But what we are proposing is an exclusively shared clinic, primarily for your employees who are on the health plan. So what that typically means is they're able to come in, same day or next day appointments are always guaranteed for your employees. They also have the ability to do a virtual visit with one of our providers. The way that we differ is we do understand that primary care is essential in today's market. We understand that it's very hard to get into a primary care provider. It could take 3 to 6 weeks sometimes. That's just not okay. So that usually means employees are taking longer sick times, taking more time off of work, and usually medical expenses are higher. So we did come up with this plan by listening to our community and understanding that primary care is essential and the overall health and well-being of employees. So what are the benefits of being able to join this group? This isn't a completely updated map. We actually do have a more updated map in your green folder. It'll be found on your right-hand side. We do have our Georgetown facility opening up here in the first of the year, as well as one out southwest. So with the per member per month cost, anyone who's on the health plan, anyone who's on that health plan as well, can actually participate in that. So for example, if you have someone who works currently at this facility who's on the health plan, any of their family members who are also with it can go and visit that clinic. We do have some proposed areas in Adams and Wells, as well as Paulding and Van Wert. Again, if people are commuting into work for their time, we want to have their family be able to access it right at home. Something that's really vital with this is typically when you do go into a shared clinic model or any clinic around Fort Wayne, usually you can only see your provider for 10 to 15 minutes at most after speaking to a nurse. Where this varies and it's a little bit different is you actually get a half hour with a provider. So they're going to ask you those deeper level questions. Why are you feeling this way? Are you stressed? How's your diet? What's going on in your personal life that's making you feel this way or act this way? Furthermore, we also have about 40 medications and a whole host of different labs on site. First fills and refills are going to be able to be done at no cost to the employee. So at no point will they be asked to bring in an insurance card, and they'll be paying nothing when they do check out. All of that will be covered in the per member. Virtual visits are a great option too. If someone is feeling ill or under the weather, they can actually sit down right at their lunch break or go out to their car and actually make an appointment, again, same day or next day with a provider to be able to come right back with a prescription in hand. Here's just a list of our current shared clinic partners. We are actually starting to see some of the data roll out and get a good understanding of what primary care can actually do to help save on your health plan. You are more than welcome to ask Cheryl or Alan or any one of our partners to see how it's going for them. We encourage you to reach out to them. We think we have a really good base with them. I know I'm kind of running short on time, so just a few things I find really important about these clinics. One, we are proving it now that there's a significant cost savings. We are keeping people out of the emergency care unit, and we're keeping people out of specialty care. For those of you who are not familiar or don't have a full understanding of that, those are your three biggest cost impacts on your health plan. So we really enjoy that. Two, if we do notice things that people are kind of your cost bloomers, we're going to physically reach out to them. So one of the biggest complaints that we heard about this was you can't lead a horse to water and make them drink. That's where we want to kind of combat that a little bit. So we actually have nurses on staff that will look at your wellness results, look at some of your claims history, and actually drag them into the clinic and say, hey, you're dealing with a high O&C, you're dealing with high blood pressure, why don't you come in and talk to one of our providers or set up a virtual visit. So that's kind of in a nutshell what your shared clinic would look like. It would be exclusive to you, and we would promise that you would always have same day or next day. So we want this to be more of a partnership with the Allen County Public Library and beyond, to where if you are starting to see longer wait times, keep us posted. We need to open another clinic and make sure it still remains exclusive. So any questions for me at all?
So what is the PEPM that you estimate for the Platinum?
We propose that at $47.
Pardon me?
$47.
$47, am I hearing that correctly?
Yes, sir.
Per employee per month?
Yes, sir.
Okay.
Goes out to,
Yeah, I see it's 135,000.
yeah, about
estimated a year.
135 a year.
No, you're fine.
Isn't care coordination and case management, et cetera, already included in your network access fee? Signature care?
It is to a certain extent. So it is a little bit more tailored to your needs, though, with that Platinum package. So yes, there are some benefits to that, but this is a little bit more engaging, a little bit more tailored to your guys' needs.
Well, for 43, I would say there should be a lot of engagement.
So, and again,
I'm
I believe you guys
surprised.
currently do wellness with us. So it's all encompassing of that. So there's no more wellness costs with it. There's no more EAP costs with it. All of it's encompassing of that.
Okay, so you, okay. All right.
Network.
Okay.
Makes sense, so it's really,
Help you.
and then, yeah, and then mind that what offset for this library. Oh,
Gotcha.
but what you also out of the payment that the labs, the drugs aren't billed separately. That's and that actually groups that are up there, I can tell you personally have had negative increases this year, and they've been in it for like 18 months. And so groups that we're seeing that don't have that kind of involvement with a clinic access, whether it be Parkview or any other clinic, we aren't experiencing that access. I mean, our renewals are looking at double digits. So I think the difference that maybe Drake hasn't gone into is this is a functional medicine approach, so it's root cause. We're really looking to help the employees engage to do preventive care, right? And then from that, look at illness burdens to some of the other things that are going on in their life and not necessarily treating with let's just hit this with some drugs and send them out the door. We're really looking to see what other types of things that are going on, do a series of lab tests because it's all there. And the lab also is within the clinic, so they don't even have to leave. So the labs are drawn, the drugs are, handled, and so they're given that access. It's an opportunity to try doing this for the next year to really see if we can make an impact.
That helps.
I do want to point out
I
too.
hope it got picked up by the microphone.
I was just going to say, and maybe a little bit bold of me to say, but my goal with these clinics and the goal with the shared clinic is to keep you out of specialty. It's really to keep you out of the emergency care unit. My goal ultimately is to make you spend less on your typical healthcare cost. So if we can keep someone who's suffering from asthma or suffering from an ailment that they're dealing with on a day-to-day basis, they're having to go see that specialist, we want to keep them out of there. So ultimately that does come back as a roundabout way of cost. Specifically, if you take someone with, let's say, diabetes who's not managing it well, or it takes 6 months to get into a specialist, we want to continue that care for them so they're not going 6, 9, 10 months without that continuation of care. So we want to work in conjunction with really any provider around your network to say, what's going on? How can we get you that script? How can we get you feeling better? Et cetera, et cetera.
Sure. Appreciate the additional information.
Absolutely.
So help me understand a little bit, am I following this right, that, so if I'm one of our employees in the county, in Allen County, right now I can go to any of your clinics, but by being a part of this program, now there are 3 specific ones that rather than waiting a month to get in and da-da-da-da, as you've explained, by being members of this, they can go to any of these 3, and it's much more responsive, longer time period. They can still use the other plant, they can still use the other
Absolutely.
resources, and why would they, at what point would they choose this versus that? Are there times it's more appropriate that they'd use this?
It can be. So we never want to replace your primary care. If you're familiar with your doctor and you want to go see your primary care, absolutely. Where this would be most appropriate, I'll give you an example of my own life and why I found it to be a benefit. So take 2 weeks ago, my wife called me and said my son was sick. It was around 6 a.m. and she goes, what are we going to do? We had to go to our primary care office and, of course, a walk-in clinic. So by the time we were done and through the walk-in clinic, it's 10 a.m. at this point, and then we had to go over to Walgreens and wait for a script. So we're at noon before our son's getting a med and we're feeling better and we're back to work. With this type of program, take that same employee and that same mindset, we almost always have guaranteed same day or next day appointments. Now, if you call it a Friday at 5 p.m., it will probably be Monday morning at that point. But take that same example and say on a Tuesday morning, you can call in ahead of time. You're in and out of there within 30 minutes with the med in hand. So I could have taken that same example and been out of there by 10 a.m. On the flip side to that is if you are seeing your primary care provider and you want to do an ADHD recheck, or you want to check for depression, or you're following up with a specialist, they're going to actually talk through each other through MyChart or public records. And they'll say, okay, you're on this med currently, how's it going? So again, that specialist is where I try to use that the most too. So if you have a 6 to 10 month wait for a diabetes specialist at any health system around Fort Wayne and the surrounding areas, this can cut down on that. So all of our providers are cross-trained in lifestyle management changes, and that's where they can come in and continue that care for you.
If you don't mind, I have 2 other things.
Yeah, go.
So basically 8 to 5, or what are the hours of operation before you go to the?
I think we have a slide of all of our hours. Let me see if it's up here, because we just updated them. Each clinic typically has, maybe we don't have them up here. I apologize. I'll have to send that over.
They have it on the,
But they do typically, do we have it in the packet? They do all have varying hours and times.
Okay.
We typically will work with our partners, so if you do have any feedback on that and say, a Tuesday at noon just does not work for our group, we'll try to tailor our hours around more of that, or if you have shifting employees who come in versus come out. So take Burn Apparel and ITI, they're more of their office work, so they wanted more office hours, but we do have manufacturing that just wanted that third shift to be able to utilize it as well.
Okay. My other question, just play this forward for me. I mean, is your intent, is this where you're hoping clinical care goes to and people aren't tied to their doctors anymore? and this is a more responsive thing that will replace the others, or is this meant to be supplemental?
Well, I think in general, the United States has a primary care
Yeah.
provider issue in general. It's so hard to get into primary care. Especially in the Midwest, we had that mindset of, if I'm sick, where do I go? I go to an urgent care or an emergency care, unfortunately. So we systemically just have a primary care issue all around. Primary care can save you costs. It's the cheapest way to get through something, and it can usually get people back up on their feet in the most cheap way possible. However, we're so inundated with patients and so inundated in our emergency care and primary care that people just don't feel like they should go see it, or it's too expensive to go see. So if you are someone dealing with diabetes or depression, you're going to have that fear in the back of your mind of, this is going to cost me, insert dollar amount here to go get this problem fixed. The reason why we wanted to start this is because people are afraid of the high cost. People don't want to have to deal with something like that. They want to be on their way. So the ultimate goal of that is to make it more accessible, less scary, and really get rid of that white coat syndrome that most people face. So our providers are actually trained to say, okay, why are you dealing with this? Let's talk about this. Rather than avoiding the issue like not taking care of your diabetes or depression, how do we fix that for you? What can we do today with the small steps to have a brighter future tomorrow? So ultimately, no, we don't want to take care or take complete, we don't want to get rid of your primary care provider. We just want to make the cost cheaper on your employees who may not ever see a primary care provider, and actually give them the opportunity to maybe talk to a specialist and get that further care that they may need. So ultimately, what we've seen is we're actually driving the cost down. We're starting to actually see those specialists open back up a little bit more by inundating more of these, because primary care is absolutely the most important thing in healthcare. I think I will die on that molehill 10 times to Sunday, because it can actually save you a ton of cost the more people that you send to primary care.
Okay, thank you.
Absolutely.
Do you anticipate opening anything downtown?
Trying to.
That'd be really
Absolutely.
helpful.
Are there any other questions from the board or anybody else? Appreciate the presentation.
Thank you for your time. I appreciate
Thank
it.
you.
The last piece of that he touched on was the EAP. So we've had our EAP through New Avenues for quite a while. We did a benefit survey this past year, and just general feedback from staff that I've received that has not been very favorable with New Avenues service and the counselors that they've connected them to. So we are requesting to move to Parkview's EAP. Currently, we get 3 free sessions a year with New Avenues, and Parkview's tier would bring us up to 6, so we would double the amount of EAP access for staff, and that's open to all staff currently, and it will continue. And you can see that it's a difference of about $4,800 for the year to change to Parkview. And they have other things like financial counseling and 15-minute management consults and discounts on training and things like that. And that breakdown is in your packet too.
Any additional questions on the group health package?
Sorry, I do want to ask one more question.
Go right ahead.
On this piece,
Yeah.
I'm not sure how you measure it, but what kind of usage or volume are we getting out of this?
For the EAP.
Yes, yes.
I actually do get quarterly utilization reports, so it doesn't tell me who went,
Right.
it doesn't tell me how often, but it tells me how many staff utilized it and for what general reasons. The last quarter, we had 5, and the quarter before, we had 3. So we're paying about $7,500 for 3 people to use our counseling services. And I just think Parkview can offer us more options and better options, and more visits.
And the premise is they're not using it because it's not providing what people really need. And
Correct,
we think
yeah.
we're going to spend more money and we're going to get a lot more
Correct.
support for it.
Yeah.
Okay.
That was the end of the benefit package. I did have some wellness information if you all were interested in just
Yeah,
how our wellness
absolutely.
has been this past year. So we use Parkview for our wellness screenings. We do a big one in January and then a makeup one in October. We had 145 staff participate in January and 22 in October. So it was a benefit totaling over $6,600 for our staff. We continued offering the Move Spring app, which is a step challenge. It can be step or healthy eating. We had healthy challenges throughout the year. We had a water challenge. So that's been popular with staff. We partnered with Parkview and Super Shots on flu shots this year. I don't have the final numbers because the Super Shots is still going through the rest of this month, but that's always well attended for staff. We continue to offer and receive a lot of participation with our wellness bonus for full-time staff that are on our benefit plan. It lets them, just by taking care of yourself throughout the year, if you get your flu shot or your teeth cleaned or your annual physical exam or you exercise so frequently, you can get points that add up to a reimbursement at the end of the year. So in 2023, because we're obviously not done with 24 yet, we had 174 staff participate. So that was paid out in January of 2024. That was 13 more than the previous year. And that was a benefit of about a little over $66,000. We have a gym membership reimbursement for full-time staff, not quite as popular as the wellness, but we had 16 employees participate last year and only 11 the previous year. So that's still a somewhat popular benefit for staff.
Any other questions? I think it goes without saying that the benefit package for the library employees is very generous, and looks like it's going to continue to be so. That's good. Any other questions? All right, thank you
Do we
very much.
have to vote on that for this one, I think, to move forward with open enrollment?
Yes.
Well, absolutely we do. Thank you. So I would entertain a motion to approve the 2025 employee benefits package. And then just to repeat, the salary and wages is next month that we're discussing? Okay.
Yeah, that'll be at the November.
Okay. All right, anybody here to put forward a motion?
So moved.
Second.
Any other discussion?
I do have a question. So are we voting on approving the clinics and the EAP and everything we've just discussed?
That is, yeah, this request.
Okay.
It's a bundle.
Yep, got it.
And was this all in the budget?
Yeah,
Yeah.
yeah.
Okay.
Yep, those have all been incorporated in the 25 budget.
Didn't we kind of do this out of order?
Pardon?
Yeah.
I didn't hear.
We probably should have done this first and then approved the budget if this was in the budget, because we technically already approved it if we approved the budget, but that's okay. It's all good.
Appropriate observation. Okay, well, with all that said, those in favor, please say aye.
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 Those opposed, same sign. Okay. Benefits package has passed. Next up is the approval of the holidays and closures for 2025.
Yep. We have those in your packet as well. They mirror what was 2024, except we don't have a staff day listed yet for 2025. But all the other holidays and floating holidays are similar to 2024.
Any questions for what appears to be an unchanged schedule?
No.
All right. I will entertain a motion.
So moved.
Second.
Thank
Aye.
you. All those in favor, please say aye.
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 Those
Aye.
opposed, same sign. All right, that passes. Board meeting calendar.
Thank you so much, Lori. Yes, so in your packet is a proposed list of dates, times, and meeting locations for your 2025 board meetings. As typical, we do try to get out to our other libraries and library buildings throughout the year. So you'll see that in February, we are proposing going out to DeSalle, where our IT and collection development and audio reading service is headquartered. In May, we would go to Tecumseh. In August, we would go to Waynedale, and in November, we would go out to Woodburn.
Okay, any questions? Any desire to reduce the number of meetings? Well, hearing no questions, I would like to
You
have
have
a
a comment.
motion.
The Waynedale Woodburn situation.
Yes.
Just curious, wouldn't Woodburn be better off earlier than Waynedale?
I had a discussion with the manager about that, and we also have to look at the availability of their meeting rooms and what's been booked.
Just
So fingers crossed that we'll still have good
Good weather.
weather in November. She actually suggested February at first, and I thought February is a lot riskier than November.
Yeah.
But good point.
Just curious.
Thank you for that comment. Would somebody like to make a motion to approve the board meeting calendar for 2025?
So moved.
Do I hear a
Second.
second? All right. All those in favor, please say aye.
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 Those opposed, same sign. Motion passes. Review of policy on computer use and internet access.
Thank you, Paul. This is another copy and paste for you. So every year on our annual report, there is a box to indicate that the board has reviewed for the year the computer resources and internet acceptable use policy. We are not proposing any changes at this time. This is the same policy that you reviewed last year at this time.
Motion to approve.
Motion. Is there a second?
Second.
All right. All those in favor, please signify by saying aye.
Aye.
Those opposed, same sign. Carries. Review of network security policy.
And this one, we will have some changes for you to take a look at. I will introduce our IT manager, Kevin Wells, who is going to do a presentation on some proposed changes to our network security policy. And you have the existing version and the proposed changes in your packet.
Hi, everyone. I don't have a presentation, so to speak. I'm just going to give a high-level overview of both policies and any questions you have. Today, given our current network infrastructure, the adoption of more cloud services, and the ever-evolving cyber threat landscape, our current network security policy is sufficient enough to check the box and just say we have one. That is not meant as a criticism to any former or current library employee that had a role in developing our network security policy and revisions after that. It's just the environment has changed, and we need to add a bit more emphasis on the aspects of network security to the point we had to stop, review, and overhaul the current policy. Comparing the two, I see the current policy as a blanket statement on network security that focuses more on the technical aspects of network architecture, physical security, and was developed with an emphasis on payment card industry security standards, or PCI compliance, and our compliance with Children's Internet Protection Act. The revised policy builds on this and places a stronger emphasis on evolving threats and includes more detailed roles and responsibilities, as well as a specific measure for users' training and awareness. Both revisions refer to separate operating procedures that can be overlooked. The revised policy sheds some light on those procedures in each policy statement. That provides concise, detailed information for library staff.
All right. Are there any questions in regard to this policy? I'd say your presentation was very well done. Thank you. I would take a motion to approve if everybody else is in agreement.
So moved.
Second.
All right. All those that are in agreement with this security policy change, please signify by saying aye.
Aye.
Those opposed, same sign. Thank you very much.
Thank you.
Thank you, Kevin.
Review of the Plaza policy.
Yes, so in your packet is our existing Plaza policy and red line suggested changes to it. The Plaza policy is a policy regarding the use of the plaza here at the main library. It has not been looked at for over 10 years, so we thought it was time to take a look at it again, particularly since we do get requests from the public to use the plaza for programming. So we work with Pete and his team regarding reviewing it. We've made just some stylistic changes that don't really impact the overall spirit of the policy at all and how the plaza may and may not be used. But Pete did recommend adding some language, and you'll see it in red, as determined by the library in its sole discretion and exercising its discretion, the library shall not evaluate, prohibit, or limit the proposed activity based on the subject matter, subject to the terms of this policy. And I'll let the lawyer do the lawyering, but my interpretation of this is that this language really cements that the plaza is considered a limited public forum.
That is exactly correct. In its capacity as a limited public forum, we have to allow the freedom of speech with very limited exceptions. And so this language will accomplish that.
Are there any other questions? It does not appear to be a massive change by
Not at all.
any means.
Not at all.
But
So I'm just curious, has there been something occur that led us to do this, or is this just being smart and thinking ahead? We're trying to protect ourselves.
Yes to both.
And protect the public as well?
Yes to both.
Okay.
Okay. Would there be a motion to approve the?
Motion to approve.
Thank you very much.
Second?
Thank you. All those in favor, please signify by saying aye.
Aye.
Those opposed, same sign. That has carried. Didn't hear Kyle, though.
Sorry, I was on mute. Aye.
That's all right. Thank you. Okay, we're down to the executive director's report.
Fantastic. You were speaking earlier, Paul, of transitions in the financial services department. And speaking of transitions, our new CFO, Jill Knoll, has someone special to introduce today.
We actually have hired for my role, which is next to me, is Carol Brown. She will be taking over for, well, she is taking over for me. She has started, 2.5 weeks she's been with us now. And so we're really happy to have her. She's actually already experienced 2 payrolls with us, a couple check runs already. She's jumped in feet first. She's doing a great job. And some point here, you'll probably be getting emails from her, claims registers, things like that. But she's just doing a fantastic job. We're really, really happy to have her.
Welcome.
Great, welcome.
And in your written report, a few highlights. The Hive has opened in the children's department of the main library. This is a brand-new space designed for upper elementary students, known as tweens, and is packed with fun and interactive ways to build problem-solving, creativity, and critical thinking skills. And it's just beautiful in there, and I really encourage you to pop in and check it out. October is our annual United Way Arts United fundraising campaign system-wide. So we had representatives from both the United Way and Arts United at our October management team meeting who spoke about their respective organizations' work and needs. And I'd like to thank our Adult Services Senior Librarian Craig Bailey, who has for several years served as our workplace campaign chair. And he thinks of a lot of creative and fun ways to build excitement and support for this annual fundraising effort. And we're grateful for the generosity of our staff. And speaking of generosity, the ACPL Foundation has exceeded its $100,000 fundraising goal for the Dolly Parton Imagination Library. I went to the Meyer store on DuPont last week to accept a $5,000 contribution from their employees. So that put us over the top and then some. So a big thanks to everyone who generously contributed to the fundraising campaign. We are working with the Dollywood Foundation now to receive training on the book ordering system and to set up invoicing and billing. And we anticipate that within 4 to 6 weeks, registration for all children in Allen County, birth up to 5 years of age, will be open. So in 2025, they will be getting their free monthly books from Dolly Parton. So very, very excited about that. I wanted to give an update about our community engagement regarding the facility master plan. This month, I have given presentations to the League of Women Voters of Fort Wayne, the American Association of University Women of Fort Wayne, as well as the Greater Fort Wayne, Inc. Legislative Committee. And as of today, we have over 3,400 community members who have signed the petition of support. I also wanted to congratulate Lorraine Bain, our Director of Human Resources, because earlier this month she graduated from GFW Inc.'s Leadership Fort Wayne program. I know that was a very worthwhile endeavor for her, so congratulations. Also, I have a visual aid here. So this is heavy. You may see our eagle here. he took a tumble and broke a wing. This is the topper for a flagpole that we use in the main library for meetings. And our staff is so incredibly resourceful, they thought, this would be several $100s to replace. And they thought, why can't we make it in-house? So Francisca, who is a maker guide in our studio, the Maker Lab here at the main library, printed this out.
3D.
3D, yes, absolutely, 3D. It took about 8 hours, probably about $20 in materials. And then, here's the example of it, spray painted with gold paint. So I just was very impressed with our staff's ingenuity and resourcefulness. And we talk about 3D printers and the kinds of things you can do with them. Well, here's an example. He's a lot lighter weight than this guy, too. And won't be as easy to break. And finally, this is the packet where you get a quarterly manager's report. I encourage you to take a look at it. It is chock full of some really amazing accomplishments and work that our staff and our departments did this past quarter. 2 items of note that I wanted to mention on page 4. You see a photo of our DuPont hold lockers. We have talked about these hold lockers in previous meetings, but in the previous quarter, thanks to the work of our marketing department, you see a custom wrap that they put on the holds locker. I think it's super attractive. These are so popular that we have ordered 48 more lockers that will be installed by the end of November. So it's been a big, big hit. And I also wanted to point out on page 28, the report from our library at home department. I was just so impressed with this number at the end of September. Library at Home serves 711 outreach services enabled patrons, the highest number they've ever recorded. You may remember that last year you graciously approved a 3rd staff member for the Library at Home department, and because of that increased capacity, this is the kind of thing that we can accomplish, so thank you. And I'm happy to answer any questions.
I have a question.
Yes.
When you went to the League of Women Voters and the American Association of the University of
Yes.
Women, what were their general responses?
They were very enthusiastic and wanted to know how they could help support the project.
Any other questions? Thank you, Susan. Okay, moving right along, any new business to come before the board? Hearing none, do we have any public comment either online or in the audience? Hearing silence, I will take a motion to adjourn.
So moved.
And a second?
Second.
Thank you. All those in favor, please signify by saying aye.
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 Those opposed, same sign. We are adjourned, and we will be having an executive session shortly after this meeting concludes. We'll give it 10 minutes or so and start that. Thank you all.
I know.
So, can I just try to keep moving?